How can you manage child antibiotic administration with resistance? Managing antibiotic use in children when resistance is a concern is all about careful planning and making smart choices. First, only give antibiotics when they are truly needed. Many childhood illnesses are caused by viruses, which do not respond to antibiotics. Giving antibiotics unnecessarily can lead to bacteria becoming resistant. So, healthcare providers should confirm a bacterial infection through clinical signs and, if possible, diagnostic tests before starting antibiotics. Second, implementing pediatric antimicrobial stewardship programs is very important. These programs involve teams of healthcare professionals who review antibiotic prescriptions, develop guidelines, and educate doctors and nurses. They help ensure that the right antibiotic is chosen, at the right dose, and for the right amount of time. Since children's bodies and infections differ from adults, these programs are tailored specifically for pediatric care. Third, when antibiotics are needed, selecting the most appropriate one based on the likely bacteria and local resistance patterns is key. For example, some bacteria like Streptococcus pneumoniae have become resistant to certain antibiotics like macrolides. In such cases, doctors might prefer using amoxicillin with clavulanate or certain cephalosporins, depending on the child's allergy history and the infection type. This targeted approach helps reduce unnecessary exposure to broad-spectrum antibiotics. Fourth, limiting the duration of antibiotic therapy to the shortest effective course helps prevent resistance. Many common infections in children respond well to shorter treatments, often less than 10 days. Longer courses are only necessary for complicated or severe infections and should be guided by a specialist. Fifth, close follow-up and monitoring are essential. Healthcare providers need to check if the child is improving and be ready to adjust treatment if resistance or treatment failure occurs. Consulting infectious disease specialists can help when infections are resistant or complicated. Finally, educating families about proper antibiotic use is vital. Parents should understand the importance of giving the full prescribed course, avoiding leftover antibiotics, and not using antibiotics for viral illnesses like colds or the flu. This helps prevent unnecessary resistance development. In summary, managing antibiotics in children with resistance concerns involves confirming bacterial infections before prescribing, following stewardship programs, choosing the right antibiotic based on current data, using the shortest effective treatment, monitoring progress closely, and educating families. Following these steps helps protect the effectiveness of antibiotics while ensuring children get the best care possible. Always remember, parents and caregivers should consult healthcare professionals for personalized advice tailored to each child's needs.